If you've ever had an ankle sprain or a knee injury, you're probably pretty familiar with the R.I.C.E protocol, which was rest, ice, compression, and elevation. Now, these guidelines originally came out in the 1970s, and due to current research, there is now a new approach to this. So I'd like to walk through some of those differences and help you come back from your injuries a little bit more quickly and a little bit more efficiently. Hi, I'm Dr. Zach Ratliff at TruMotion Therapy. I'm a sports chiropractor, and our office specializes in the conservative management of musculoskeletal pain and injuries. So many of us are familiar with the R.I.C.E protocol. If we were ever injured playing youth sports growing up or anything of that sort, this was typically the method that was employed. Now, with current research, there are a couple factors in this protocol that have been updated or kind of moved away from. So we'll start with this one. Rest is one of the issues is it can prolong your healing times. Yes, we obviously want to avoid further injuring the area, but prolonged rest or ceasing all activity can actually have some detrimental effects, such as decreasing circulation, increasing stiffness and restrictions in the joints, and sometimes this can prolong the period of time before we can reach back to full function. Ice has been researched a lot over the years. What we can gather from it is a process that vasoconstricts. It's going to reduce blood flow to an area, and what that's going to do is actually hinder and slow down some of those healing processes. So in certain cases, it might be applicable, but for the most part, as an overarching rule, ice might not be the best option. Now, compression and elevation, these ones have stood the test of time, and we'll talk about how these integrate well into the new protocol, but both compression and elevation have been shown to be helpful. The replacement for the R.I.C.E protocol is called the Peace and Love protocol, and what this does is it puts a couple more specifics on certain things and also has been updated with where our current research is at. As far as sports medicine and acute injuries go. So let's walk through a couple of these steps and we can kind of compare and contrast to the previous R.I.C.E protocol. So the first one is going to be protection. So right after an injury, obviously we want to protect that area and keep it from further harm. So that one's a pretty self-explanatory one. Elevation is one that has carried over from that R.I.C.E protocol. Elevation can be great for helping gravity help us. So when we have swelling or a little bit excess fluid hanging out in any area, elevation can kind of help draw that back into the lymphatic system and help that healing response. This one can be a little confusing one, avoiding anti-inflammatories. So anti-inflammatories are a great medicine. They have their time and a place, but for a lot of injuries, it might be worth considering that the inflammatory cycle is actually our healing response. So in some cases, this can actually slow things down or hinder your body's natural healing response. Now, compression, another one that carried over from the R.I.C.E protocol. Compression has kind of performed well in the research and shown that it can help move excessive fluid out of an area, as well as just allowing the body to then circulate a little bit more efficiently. Now, the education component of this is understanding your injury, seeking out resources or a provider that can help walk you through these steps. So education on your injury and what you can and can't do, or what might be beneficial or not beneficial, can be helpful in that situation. Now, the next component of this revolves around more of that journey back to your full function in the sport. So loading the tissue. So when we have an injury, we want to challenge the body as much as we can, because that is going to be a good stress on the body that helps it regenerate and recover from those injuries. So we do want a little bit of stress in order to encourage that healing response. Optimism. This is an important one of when you're in injured state, you can be separated from your team or your community, those types of things. So it is important to stay optimistic during these times, as the way that you're approaching that is going to affect kind of your brain-body connection and how well your body is able to recover. Vascularization is going to be an important one. Doing things that promote good blood flow throughout the entire body is always going to be helpful when we have these sports medicine injuries. Say you cannot run or do weight-bearing activities, other alternatives such as stationary bike or other things that can get your cardiovascular system rolling is always going to be a good thing in promoting just good healing throughout the body. And then the exercise component of this is going to look for what most of us would think of as like rehabilitation. So after an injury, one of the biggest factors for re-injury is a previous injury. And so all that to say, we need to make sure that our tissue has recovered well and that we have brought it back to full strength and stability so that we can avoid future injuries. I hope you found this helpful and that there's a couple new things that you learned as far as acute injuries. If you are in the midst of an injury, I would encourage you to check out our website at TruMotionTherapy.com, where we have more resources, videos, and the ability to schedule an appointment with one of our providers. And we would love to help you navigate your injury and get you back to full function.